Age of the first pregnancy less than 20 years and the multiparity with the poor birth spacing, early intercourse, poor personal hygiene and the multiple sexual partners, HPV 16 eating commonly leads to the adenocarcinoma, HPV 6 verrucous carcinoma and the HSP2 HIV. 99.7% of the carcinoma cervix is associated with the HPV. Other type of the HPV which are associated with the cervical cancer carcinoma will be the HPV 18, 31, 45, 51, 52 and 53. OCP and the progesterone usage over the 8 years period can cause the adenocarcinoma of the endocervical, double the risk. This exposure in the childhood, low socioeconomic status, smoking, alcohol, drug abuse and the immunocompromised. Symptoms arises from the squamous-columnar junction, earliest symptom postcoital bleeding. As the cancer progresses, symptoms may include the unusual vaginal discharge, vaginal bleeding between the periods, bleeding after the menopause. Pyometra, bleeding or the pain during the sex, site ectocervix, lymph nodes affected, obliter hypergastric and the external iliac. Time taken for the conversion of this into invasive carcinoma 10 years. Next type squamous cell carcinoma, 100% cure rates are seen in the CISA. Eutremia, altered sensorium and is having the hiccups. Next cause of the death, renal failure. Next cervix can be prevented by screening. Best method for diagnosing the cervical biopsy. Investigations used for staging of the cervical carcinoma according to the figure are mandatory for staging. Speculum, vaginal and the rectal examination. Abdominal ultrasound, intravenous urography, pyelography. Coloscopic study of the vagina and the vaginal cornices. Supplementary for staging, cystoscopy, proctoscopy, cone biopsy, endocervical curettage or the smear, chest X-ray, exfoliative cytology, skeletal X-ray or the bone scan, cytoscopic examination of the bladder and the urethra, proctosigmoidoscopic study, barium minima, elevated CA 125, electrocardiographic studies, pulmonary function studies. Intravenous pyelography, cystoscopy and the proctoscopic investigations are used in the figure staging of the carcinoma cervix. A case of carcinoma cervix is found in the altered sensorium and is having the hiccups likely causing uremia. Carcinoma cervix is common at the squamous-columnar junction. Postcoital bleeding is a common symptom of the carcinoma cervix. HPV 16 and 18 are associated with the high risk of the carcinogenesis. In carcinoma of the cervix, lymphatic strain to the hypogastric, external iliac and the abductor lymph nodes. Adenocarcinoma cervix is associated with the HPV 16, 18 and 51. Postcoital bleeding would be the earliest symptom of the carcinoma cervix. Carcinoma cervix involving upper two-thirds of the vagina without the parametrial involvement are classified as a carcinoma cervix. This is the commonest cause of the pyometra. Can be prevented by screening. Complications which result in the mortality in the carcinoma cervix is the renal failure involving upper two-thirds of the vagina. The stage would be stage 2A. Risk factor for the carcinoma cervix is smoking.